We had the idea for years, and the concern was that if we wrote the book, would we teach people how to poison? Well, as time has evolved, the interesting thing has been the internet. The internet has put out much of this information. What we found is the perpetrators were getting smarter than law enforcement, were getting smarter than the clinicians. And so after a lot of discussion, we decided, yeah, it was about time that the book come out. Some of the characteristics of clinical poisoning written at the level of law enforcement and at the general practitioner. We certainly have had cases that have come to our clinic with a concern of arsenic poisoning. There have been cases of poisoning with opioids, such as morphine. There have been cases and concerns regarding the potential for cyanide. Certainly when it comes to terrorism preparedness, it also falls in that realm, and what agents might we be worried about and should we prepare, especially from the clinical standpoint. How I look at these investigations and what I've learned in time is that I see the analogy of a table, and for a table to stand and be stable, you need to have 4 legs or pillars to hold up that top. If one of those legs is removed, it of course gets wobbly, and the more legs you remove, the greater chance it will fall. Well, likewise, I see the investigation similar. You need people with clinical expertise in poisoning as one leg. You have another group that does the analytical, who's taking the biologic samples and testing those as the other leg with expertise. The other is law enforcement as they do the investigation of these. For example, getting the computer hard drives and seeing what search engines, where did they search for poisons. And then there's the trace elements experts who can do testing in cups and syringes to see is the poison there and how it was administered. And if you have all 4 of those working collaboratively, not outstepping their areas of expertise, that is when you can have a really successful investigation into a criminal poisoning. We manage patients who are poisoned on a routine basis, and we know the clinical signs and symptoms associated with poisoning, and there's a lot of misinformation out there in regards to poisonings and how they present from the criminal realm, and what we're trying to highlight in this book is what clinical signs and symptoms should really clue you in. What things would you look for? What is in the evidence right now in the literature to support that those exist? What we're looking at is the medical records, for example, of the patients when they either presented or cases who didn't die, who came and saw us into a clinic who may have been poisoned, for example, with arsenic and have the clinical characteristic signs and symptoms of arsenic poisoning. And so there's truly a difference in expertise between a clinical toxicologist, a pathologist, an analytical toxicologist. We all have our realms of expertise. I think you can run into problems when, for example, a medical toxicologist who works in the clinical realm starts to try to explain in depth the analytical, that the PhDs are colleagues who we work closely with, what they do. Likewise, to have a pathologist who works with samples who isn't working in the clinical realm, seeing these patients when they come to the emergency departments or when they come to clinics, for them to start opining as to what are the clinical effects and what do they look like when in fact they've never seen that, they should not overstep their bounds. And I think it gets very tricky there. Yes, I can read books, I can read about what my colleagues are doing, but truly you want the experts who are doing those activities. And if you start to overstep your bounds and where your expertise is, that's where things start to fall apart, in my opinion. You can have an analytical toxicologist who works in the lab. You can have a PharmD who works in a pharmacy. You can have a MD who works in the clinical realm with patients in a clinic. There's many different toxicologists who are out there, and they all have unique expertise, unique things to offer to the team, but it's a matter of knowing exactly who is the expert in that area. What do they have to offer? And I think that is a very important distinction. When we talked, the editors, Greg Sadoff in forensic psychiatry, Tom Neer, who's with the FBI, recently retired, Brent Furby, who's with Indiana University, we did feel that it was time that this book came out, that people had a resource to go to. Again, is this meant to be a scientific book that it goes in depth as to methodology and analytical? It's not. This is meant for the general law enforcement officer, for the general practitioner in medicine to be able to read, look at, and say, that makes sense. They're brief, they're meant to be that way, There's a quick overview. There's references, so if they want to get more in depth, they can. But again, it's a quick reference for them to look at in regards to criminal poisoning. A 17-year-old boy was at a classmate's house when he complained of not feeling well, slumped over, and began to have seizures. Prior to this, he was in good health with no history of medication or use or substance abuse. Responding paramedics upon arrival conducted an assessment of the unresponsive patient. Throughout history, cyanide has been utilized as a poison in warfare and in murder. In ancient Rome, Emperor Nero reportedly used cyanide in the form of cherry laurel water to poison enemies and family members. Bonaparte proposed using cyanide on the soldiers' bayonets during the Franco-Prussian War. During World War II, cyanide caused more than 1 million deaths in Nazi gas chambers. In 1978, Jim Jones of the People's Temple of Guyana employed potassium cyanide in a mass suicide resulting in 913 deaths. In 1982, 7 deaths resulted from the consumption of cyanide-tainted acetaminophen in Chicago that subsequently led to a requirement of tamper-resistant pharmaceutical packaging in the United States. The Aum Shinrikyo cult left potassium cyanide and dilute sulfuric acid in restrooms in the Japanese subways. However, the materials were found before they could be employed. Honorable Meese and Lord Alderdice, both of them, this had significance to them because they had seen significant poisonings in their countries at the time when they certainly are very involved in politics. For example, Mr. Meese, he was the Attorney General of the United States when the 1982 Tylenol tampering occurred. John Lord Alderdice, certainly Britain has had its share of poisonings with Litvinenko, certainly with the medical murder, Harold Shipman. And so this book did have pertinence to them and meaning. Lord Alderdice is a physician. He's a psychiatrist, certainly knows the medical profession well. Honorable Ed Meese, as Attorney General, certainly knows the pertinence for law enforcement. So the two of them together were good enough to forward this book. Also realize that both are very involved with the critical incident analysis group at the University of Virginia and have been for some time, and have provided tremendous leadership there for that group. It should be also noted that Research Strategies Networks, of which Ed Meese is the chair, foundation helped to provide funding for actually one of the University of Virginia's graduates, Sabrina Rissing, to do the editing of this book. And that was a tremendous help to us. As we put this book together, we wanted to make sure it read very well. And to have someone who is not in law enforcement, someone who is not in medicine, take a read of this before it went out, her edits were fabulous. And I can only thank enough Research Strategies Network and Honorable Ed Meese for having done that for us.